So remember, I have to make a decision now. Where do I start? Oketsu, immune, adrenal. So for the sake of order, Oketsu, immune, adrenal. I will share with you, risking confusion, but I will share with you that in the clinic you'll start triaging and going by what is stronger, meaning what is lighting up stronger, and what is lighting up stronger and is connected to the presentation, overall presentation. That's the one I'm going to go for first. Oketsu, we don't need to do. Immune will start up. Now, the nice thing about the immune is that I have two levels to work with. I have the acute, yes, external pathogenic factor invading the body level, which is the lymphatic chain at the region of triple Wilmer 16, which is also called behind the SCM. And if there are lymphatic gland congestions there, I will be working on reducing them first using those points and the arm called large intestine 10, 11 area. If I successfully reduce the pressure pain and the congestion of the lymphatic glands at the neck, I will be able to relatively confidently say that it has reduced the pressure pain at the abdomen as well. If not, I would be perplexed and I would look and investigate what else can it be. Now you see this? Yes, you see this is the SCM behind the SCM. That's exactly where it is, okay? Now you can relax. Thank you. A little bit here. A little bit here. Not so much here, but definitely, I can definitely feel those here. Can you feel that? Mm-hmm. Now, again, the nice thing about checking the neck and having findings in the neck, it will also be easy for me to do the ipsilateral treatment to the neck. Yes, the large intestine 10-11 area on the left side will treat the left side of the neck. Large intestine 10-11 area on the right side will treat behind the SCM on the right side. So you see, I'm coming into the position where it's comfortable for me to palpate, where I'm relaxed. I don't have to strain my body to palpate, because then the palpation will be more, this is a bit tight. Can you feel that? Could you see that? Yeah. My finger is like on the ridge. It is tight indeed. Okay, so now I'm pressing on the chain of points possible at the large intestine 10-11 area, and I found definitely one here and definitely one there. First, I'll press with this finger, and what do you think? Still some pain? Still some pain. Now I'm going to press with this finger. How is this?
No pain.
No pain. So this is the one that I will choose. The needle painful? Is this painful?
Trace.
Still trace, okay?
Nope.
Now what I want to do is, I want to see if that immune is now less painful.
It's less painful, still there.
Still there. So let's go and see on the other side. So what I'm doing here, there,
Even less.
even less. Okay, so let's put the needle in the even less and then push on another point.
No, it's not less. No tenderness.
No tenderness, okay. So if there is no tenderness, we can move on, and we can now go and treat his adrenal gland, quote unquote, meaning I will now see if I can raise the pressure pain at the ASAS with kidney 9 on the right side, and his pressure pain on the kidney 2 with metal water on the left side. Again, I found it. My finger is going to be on the ASAS. Now, how to find the kidney 9. Kidney 9, you put your finger on the gastrocnemius and you move down until the gastrocnemius and the kidney channels merge, so like that. So where is kidney 9? Kidney 9 is somewhere in here. All right? Somewhere in here is kidney 9. I know it is somewhere in here. So kidney 7 is here. Kidney 8 is here. Kidney 9. Let's start here. What do you mean, let's start here? It means that I found in this region a few morphological changes. I found tightnesses. I found area where the tissue becomes a little bit more congealed, a little tight. So I found it here, I found it here, I found it here, and often one of them is the acupuncture point that I'm looking for. So let's start. I'm pressing on the point, perpendicular or a little bit with the flow of the channel. Okay, so my needle, is the finger, and now I press back on the inguinal. Did not change. All right, let's go back. Here.
Unchanged.
Here.
Unchanged.
How is this?
Unchanged.
Okay, so it's more here, yes?
That's better.
That's better, okay. So again, that's better. I still keep my finger there. The inguinal region is tricky because once I found the point, it's hard to go right back exactly to that point. So it's good to keep the finger there. Okay, how's it now?
Less than initially.
Change the angle.
Even less.
Even less, okay. Change the angle and a little bit the depth.
Much less.
Much less, okay. We know that the change of the angle is more let's say corresponding to a fascial plane. And the fascial plane, when you change angles and when you change the depth, you're actually hitting it in a different kind of way. You're creating more fibro manipulation, and you actually hit different buttons within that sphere. Okay? Again, maybe. The interesting thing is that we cannot just think that because we put the needle in a point, the point will be active. That's my message. So kidney 2 is still painful. So you'll have to tell me about the nerves that fire a little. Kidney 7. Kidney 10. How is this?
Less painful.
Less painful, but still there. So let's go and change the angle at kidney 7. How is now?
Still less painful.
Let's change the angle at kidney 10.
Still less painful.
Even less than before.
A little
Or
bit.
change the location just a little bit.
Only trace painful.
Only trace. What I'm interested to see is, remember large intestine 20 that was painful when I tested it? 1, 2.
Unchanged.
Unchanged. Okay. Now, let's go directly to the navel. Fun?
Unchanged?
It's tough because I have a fingernail that goes right in the side of the, of the nose. So it is a very severe test. You almost have to get a slight level of analgesia and not just reducing the pressure pain.
Unchanged?
And I told you also,
Unchanged?
okay, that don't ask a question if you don't have an answer. So now I have a question that I'm looking for the answer. So in the ear, okay, I'll show you here. In the ear, I'm looking for the representation of the nose, okay, of the nasopharynx, at the nasal cavity, and the alanasi, that whole region, yes? And I'll try and see if I can find something here. So
Yeah, there was some soreness over there.
here?
Yep.
How about here?
Nope.
So here, yeah. Okay. So let's do that again.
No pain.
Okay. All right. So again, I'm not going to needle that, but note that again, I'm looking at the constitution, I'm treating the constitution, and now I can concentrate on the symptomatic presentation. Not going to look at the symptomatic presentation without treating the constitution, because I think he has nasal sprays that work better. Do you understand what I'm saying? That's not my point in acupuncture. My point in acupuncture is that from inside out, he will start healing, and then for his relief, I can put 1 or 2 points that actually change right now, right here.